Καλησπέρα σε όλους. Σας ευχαριστώ που έχετε έρθει. Αγαπητοί φίλοι, καλά μου παιδιά. Η Industry.tec είναι μέρος μιας προσπάθειας, ο όμιλος του Press, να εγκαθιδρύσει μια σταθερή σχέση με τη βιομηχανία, να έχουμε μια έκθεση στην οποία σιγά-σιγά οι βιομηχανικές εταιρείες, τα ακαδημαϊκά ιδρύματα θα έχουν αυτό το βήμα και θα εκθέτουν τις τεχνολογίες τους προς χρήση στο ευρύ κοινό. Για το πρώτο κομμάτι της συζήτησης, η συζήτηση θα γίνει στα αγγλικά, γιατί έχουμε μαζί μας από το Ελιξίριο ένα ευρωπαϊκό έργο Marie Curie, τους υποψήφιους διδάκτορες. Οπότε για το πρώτο σκέλος της πρώτης μιας ώρας θα είμαστε σε αγγλικό mode. Το δεύτερο θα είναι στα ελληνικά. Οπότε, today it is a great pleasure to host and organize these two special sessions on the digital transformation of the healthcare and the industry sectors. Among us, there are top-tier policymakers, ex-parliament members, studios, professors, health industry practitioners, and system integrators from data and cybersecurity. All these guys shape the future of the digital transformation of both sectors across the European Union, and will share with us their viewpoint with regards to the exemplary case studies from real-life practice. Now, I will try to say a few words of how I personally conceive what the digital transformation is about. Okay, so firstly, we have to focus on the process. So we have a process, we need to digitize it, and we need to identify what outputs are to be delivered, what are the KPIs to achieve, and nothing digital by now. Having done so, then we need to map the main components of the process, the stakeholders, who is involved, what kind of infrastructures are involved, what kind of data could help us. And again, by now, nothing digital. After doing so, then we need to convince a few well-paid guys on the gains expected from the digital transformation, translate them into added value and KPIs, and identify the return on investment, search for the compliance to standards, and identify other KPIs regarding the quality, the time to market, many other parameters. Now, after doing all that, typically digital transformation includes some free of charge meetings with academics and a few consulting companies that provide some promising solutions. And I can tell you by my small experience in the Greek status that the digital transformation process and the effort stops somewhere there. Okay, so at this point, I guess that the digital transformation will happen, but at the moment we're far away from doing so. Moving next, for those that are brave and have found some credible doers, then the digital transformation begins with understanding the data that we need, the sensoring equipment and cameras that we need to collect this data, the platforms on the edge and the cloud in order to process the data and analyze this data in order to get some insightful and actionable decision-making procedures. So, by doing so, maybe we integrate some robotics, maybe we do have some immersive applications, some digital twins, a little bit of all of that, and then pressing no buttons, we try to have the understanding of what happens to the process that we need to digitize. Well, if we do all that, then I guess we are Industry 4.0 champions, but even though we've done that, there comes the Industry 5.0 example. Okay? So, although you have achieved 4.0, then you still search for 5.0. And 5.0 is about sustainability and resilience. Resilience is necessary to address aspects that have to do with the weather, with the changing market conditions, and many other stuff that we will have the opportunity to analyze. So, part of the reasons we are here is that we have this really nice project called the Elixirion. It's a Marie Curie doctoral network that aims to deliver some exotic technologies for the moment in order to have some really nice services for the healthcare 4.0 paradigm. So this brings us to the first panel on the digital transformation of the healthcare sector. where we shall address different aspects together with my good panelists. So I wouldn't spend more time in saying more things about that. Let's pass to our panelists, where I would like us to have a first round. Everyone, it would be nice to present him or herself, present the role of his institution, and after that we will have the opportunity to also discuss more about case studies, technologies, policies, standards, and so on. Stelios is a record man, you know, in Greece. I think he's the person with the most votes in any election held in our state. He's an extraordinary person. He's very active in promoting healthcare issues and addressing things that have to do with the well-being of our community. So, Stelios, we would like to hear about your role, your vision, and the institutions that you might represent. He's also a psychiatrist. If you need something, Stelios is one of the best.
Thank you very much, Professor Xenakis, for inviting me here and to discuss the future on the health. And it's a very timely subject that we need to discuss more and more. As you said, my name is Stelios Kibouropoulos. I'm a psychiatrist, but some months ago I used to be a member of European Parliament, focusing on the issues of health, of public health, and from this point of time, I try with all my efforts to continue for fighting for a better health, using the digital health, using the technology on health. So I try to understand and to create the right momentum on other services to use the technology for the good of people. So we are here to expand this discussion and see what can we do in a better way from one hand to support the health, but on the other hand to reduce the funds in order to make some investments on digital health for a better health.
Nice. Thank you. Thank you, Stelios. So let's pass to Dimitris. First. I think she's fine. She's a strong lady, I'm sure for that.
So hello from me. I'm Dimitris Katsianis. I'm the Deputy Chairman in the National Infrastructure in Greece, in the GRNet as is our brand name. EDITE is the Greek name. So we are the authority that we are running all the national infrastructure for academia, health, culture, and governmental sector. We are hosting, the most famous is the gov.gr, that everybody is using right now. We are implementing the wallet. As far as concerned the university, the academia sector, we are in the institution that serves for the interconnection between all the university and the institutes among Greece. We are maintaining the data center. We have 6 data centers right now that they are under our maintenance. Our supervisor is the Ministry of Digital Convergence, and we have moved to this ministry since 2019, and we are here for 5.5 years. Before that, we were in the Ministry of Education. That's why we have this cross relation. And since I can see very many students here, we are running all kind of business that has to do with the students. The appella that you are for the professors, Evdoxos that you are make all the subscription for your books. And nowadays we are running all the cloud and the new infrastructure for the artificial intelligence in all sectors, including the health sector, but I think that in the meantime we will have more time to analyze this AI and health sector in more detail.
You are Dimitris, thank you. So let's pass to Professor Katelidou.
Yeah, thank you. Thank you very much for the invitation. So my name is Daphne Katelidou. I'm a professor in the University of Athens. I teach health management and quality for healthcare services. I'm also the president of a newly established for Greece organization. It's the National Organization on Quality Assurance and Improvement in Health. To be honest, I think I'm the least familiar person in the panel with this exhibition. So officially I'm here to learn from you about innovation, digitalization, etc. And I already saw some very, very interesting progress that has been made through Dionysis team. So I'm here to learn more.
You know, your role is really important to this panel because apart from technology without the case study, without the usefulness of what we are going and targeting to do, has no meaning. So policymakers, health practitioners are the number one towards this effort. So you're being very modest.
I'm going to share challenges with you then. And let's find the solutions together.
This gives meaning to any technology. So let's pass to Professor Xenakis. Christos Xenakis.
Thank you, Dionysis. Two Xenakis in the same panel, so this is strange. Okay, hello, my name is Christos Xenakis. I'm a professor in the University of Piraeus. I'm a director of the Master Course Cybersecurity and AI Technologies, and this is also my area of expertise, mainly cybersecurity, and recently we are working on AI. Mainly on the cybersecurity for AI technologies are how AI affects cybersecurity, because these two fields are closely related. I am also the head of the Hellenic Cybersecurity Team, a team of young researchers that participate in the European Cybersecurity Challenge for the last 10 years. And also I'm participating in many European projects as a coordinator or principal investigator. And we have also one project that has recently started on e-health sector. Thank you.
Thank you. Let's try now to focus and try to identify what is the status of the healthcare system across the EU and also in Greece. So, although all these technologies seem to be nice, how far are we from being there? Because in our project, for example, we are discussing about non-terrestrial networks, edge cloud continuum, stuff like that. But I think we have, as a first step, data is the most important thing, and this is one of the things that we need to address. So I think that, Stelios, would you like to start?
Yes, I think that on European level we have a great base of frameworks. GDPR. GDPR is the first very wide protection of data. We have seen that it's working not so very well at the moment, but I think that we have created a better framework, and we have tested during my mandate, 2019-2024, we re-established GDPR. So I think that in the near future it's going to work better. A second tool that we are going to use is European Health Data Space, which is another level of specific using of health data, which can support the use of personal health data not only for Greece but also in whole European area. That means we create a better pool of data which can be used for research, and we can support the funding. But in order to use all of these tools, what is missing and what is the issue that we need to focus more on this is cybersecurity, is security. So I think that from this moment and for the future, we need to use a wider term, which is health security. So we need to see specific initiatives which are talking about security on data. One month ago, an initiative was published by European Commission about the protection of data from hospitals. So we see some steps, but I think along with the security on protection, on work protection, we need to see the security on data. And I think that European Union is the best place to create this protection of health data.
Yes, Stelios, you're right, because although the Europe is considered to lag in terms of deploying the technologies and using them, actually it provides always a regulatory framework. And this is important because it protects people and it establishes specific means on how to use these technologies. So thank you for bringing forth the regulatory framework and also the challenge of cybersecurity. And now I want to pass to Professor Kaitelidou, because all these things with data and how we handle them and all the technologies also from the regulatory viewpoint are really nice, but in practice, from the health practitioner, what is the actual status of the healthcare system and what are the next steps that are immediate, that are right in front of us, coming, not far away, just for now?
Okay, thank you, Sest. Dionysus, then we come to challenges, and I think one of the most significant challenges for the Greek healthcare system is to transform the raw data that they exist. They are in various sources, but they are fragmented. So to transform them into meaningful information and to knowledge for the healthcare professionals. One of the biggest challenges that we've been facing for decades is the lack of an electronic health record. So the patient's information is stored in paper. A lot of information is missing. A lot of information is sometimes duplicated. And there is no way to have a continuity following the patient as he moves, also as he progresses from one healthcare organization to another. For example, from primary healthcare to hospitals or to after-hospital care. So I think this is one of the most important barriers that we are facing for the continuity of the information. Another one is the fact that the hospitals have separate IT systems which are not interoperable. So the data that kept in one hospitals do not operate with another hospital. Again, this is a problem in the continuity of care and patient. So there is a lot of information lacking and there is no integration of knowledge so far. You asked me if there is progression, and hopefully yes, there is. After a lot of years that we've been just discussing about difficulties, I think that we are in a point where in this year, by the end of 2025, we will be having an electronic health record, and I think this is a great progress. This impacts the quality and patient safety, as you may understand, so this is something that we are expecting. And there are also efforts in establishing interoperable applications for the hospitals. There is one going on for 12 oncological hospitals. So it's the first time that 12 hospitals share the same space, IT, digital space, and we are able, or we will be able, I think April is the deadline for that one, to actually follow the patient throughout the course, the pathway in the healthcare system. Mm-hmm. So there is progress, we much need it in our country, but then again I will come in more challenges in the course of the...
So you highlighted data continuity, the consistency of data across the different data silos, and also the interoperability of IT systems. Yeah. You're right, these are three very critical parameters that we need to address in order to have the fuel of the digital transformation which comes from data. So I will come back to this really nice approach that you brought to light. So let's pass to Dimitris. So Dimitris, can you tell us more? Daphne has brought to light the effort to have the data. Now, can you tell us more about the infrastructures, for example, in GRNet, on how we're going to process the data, how to derive actionable results?
Okay, let's be more clear and for the audience. The first thing that we have done in Greece is to start to maintain or start to buy all the time new infrastructure for that. So in GRNet and in the e-health system for the digital governments, IVICA is the electronic, is the responsible for the data nowadays.
IVICA, yes.
And we have, for the academia, we have the research cloud, and for the health, we have the H cloud. So we have these two infrastructure ready to host the data. From the previous year in GRNet, we have already collected a huge amount of data because we are running this project under the name of Harmony. So with this data, we collect all this, for example, all the X-ray from the patient in Greece, and we are hosting this data in our data center in Crete, in Knossos, inside the University of Crete, of course. So that was the first step, to have infrastructure and to have data. So what happened with the data right now? Can you use the data? The answer is that we still trying, and we just present, the minister just present in the Ministry of Council, in the Prime Minister, at the end of January this has happened, so I mean 15 days ago, the draft bill for the Data Governance Act, which is a quite important step in order to harmonize the use of data, in order to define even the penalties for not using the correct act. And within this draft bill, one of the most important issues is that we're going to have something like project officer that are responsible for the data in the Greek government. So within this initiative, we will have the data clear and ready for the next project to be used. For example, we will create a new ecosystem for the artificial intelligence in Greece. The project is Pharos, which is based in the infrastructure of the supercomputer of Daedalus that we are going to build in GRNet. And in this project, we have three very big pillars. One of these is the health pillar. So, with the Digital Convergence Act, we will be ready to use this kind of data in appropriate way for the academic and the private companies to have the ability to create application and services based on this data that will be protected under this act.
Mm-hmm. So you see a role for GRNet in hosting and processing healthcare data from our hospitals?
No, this was the role up to Harmony, so we still keep into to host and maintain or to create this data. We have a DR, for example.
Okay.
We have a disaster recovery for this kind of data. During the last 5 years, we maintain a big part of the network in the hospital as well. So when a necessity had come, the GRNet was there to offer the service. Now, IDICA has running a very big project for the new data center for the healthcare, but this will work in parallel. Okay. We are not...
Okay.
So the most important is that we have the data, we make the clearance of the data with the Digital Governance Act. We have this data officer. We will have this data officer in the public sector, which is quite important, who is responsible for giving what and under which conditions.
I look forward to see which person is going to be appointed in this
We are looking for persons to hire
it
if you
will be
want
really
to.
challenging to have someone.
It's challenging, but it's the implication of the Digital Governance Act. We have to do it.
Yeah.
That's why we will the Minister of Digital Governance present this draft bill.
Okay, thank you, Dimitri. So, Christo, you have a really good understanding of what are the healthcare stakeholders. It used to be the patients, the doctors, the nursing, the providers of the infrastructure and the medicine and stuff like that. Now we have insurance companies, now we have other kind of brokers, healthcare brokers, so this is a really challenging ecosystem to map. Now, building some platform that leverages data from the patients, the doctors, the hospital, having insurance companies and all of that, how do you see the protection of data and the protection of infrastructures that need to be open to all of these actors?
Yeah, I think this is a very challenging task.
Yeah.
And has a lot of issue to be considered. But before going to this, I would like to say that we are behind the schedule, or what is required. Speaking with the hat of a technology guy, okay, I'm not a doctor, I'm not a politician, I'm a member
I'm not both of them, like Stelios.
Yeah, but we have to say that we are behind, far behind.
We're lagging. You're right.
At the Greek level and the European level, and I can justify this because right now we have AI and all these very attractive application and technologies, and we are speaking at the European level for the digital transformation. I see the risk of cybersecurity. I'm serving this sector and I know very well, but I insist that we have to move forward fast. Because, okay, the risk is there of cybersecurity, but on the other side, we have to see the advantages of the digital transformation and all let's say, the exploitation, the good exploitation of this data. We may have predictive diagnosis of many diseases. We can help the people to live better and to treat them in a better way. So I believe this is more important, of course, of some concerns, of some ethical concerns, privacy concerns that are there, for sure. So I think that the cybersecurity, Dionysus, if this is question, this is a huge task. But at the beginning, we would like to see the digital transformation, to see the data to be digitized, to see the applications that will help the doctors and all the medical care providers and the patient. We are all patients. We have all health data at the public hospital system. And after that, we have to consider the cybersecurity, of course. With this respect, we need investments, real analysis and investment in the cybersecurity, and then a balance among usage with AI systems and all that stuff, and compliance, which is something important, but of course we have to consider this, because putting a lot of regulation, I think this stops using data. It's a balance. It's a balance we have to consider and find the optimal solution.
Nice. Thank you, Christo.
Dionysus, I don't know if it's what I'm going to say is related with the topic of our discussion, but I think that another topic that we need to put it on our discussion is if the people are familiar with this topic, with security, and where people put their data. Let's say ChatGPT. Is it safe for them to use their data in order to discover something for their health? So I think that we need to teach them somehow how to use their data.
Stelio, you reveal a very interesting point. As soon as you put some data or a question or some data to the ChatGPT or DeepSeek, I would like to be...
Whatever.
you feed the system. I would like to be neutral. You feed data to this machine, and so these data are not any longer your data. These are fed to the system, so there's no privacy. Can be used and will be used. Another issue is that we have to train and educate the people. We need campaigns about how to use digital services and how to treat data. Sometimes we over-concern about how a hospital or a government body use the data, while on the other side, we upload all this data to the Instagram, to the Facebook, to the LinkedIn. So, for me, we should care also for the social media, and perhaps the public sector has all...
Therefore, I think that it's time to understand and to live with European health data space, because it is a very new project, and at this point we need to educate people how to use their data and what that means.
Yes, what are the implications? You're right. And I think it's also a good pass for you, because you're actually leading some cybersecurity challenges, events, hackathons that try to familiarize the general public and the enthusiasts with the cybersecurity technologies, right?
Yes, but we have to do many things, because we are behind again in this field. Because right now the people they cannot understand by using internet or by using digital services how their data are treated and are consumed by whom.
Let's talk about investments needed and the technologies that we should target first. So, Daphne, congratulations. You are the Minister of Health and Well-being for the sake of our discussion. So, what should we do next in terms of targeting specific technologies that will take us not far away, but for the first step of transforming the healthcare ecosystem now? So, where should we invest?
Yeah, that's a difficult question.
Excuse me, this means infrastructures, this means education, this means personnel. It's up to you. So you're the minister, right? I'm just asking the question.
Thank you for the assignment, but to be honest, it's one of the most difficult ministries, I think Stelios knows, so I prefer to speak as an academic.
Okay, I'm good with
and
that.
I think, to be honest, Dionysis, I've been reading and listening to this discussion about this digital world, and I think that from another point of view, and I'm going to share it with you, I always say, if we had the data, all the data that we needed, and if we had access and data sharing agreements and the European data space, which is the one that we are expecting, then again, in our country, we have to see our own needs. And I think that it's quite important to know how to process the data, to analyze the data, and get the information. So I think in our country, it's definitely, apart from investments in infrastructure, I think investment in training, education, both for health professionals and for patients, is very much needed. I mean, these data have to be meaningful and they have to drive policy making. So I think that one of the axes that I think is a priority is the upskilling of the whole health system in digital transformation, in data analytics, processing, structuring, contextualizing the data, and for me it's a priority. Then I will have to say that since one of the challenges that I already mentioned is the scattered data in different sources with different methodologies, I think this framework for sharing a common language in data is also very much needed in our case. And I think what we also need to do more in the future is to use more real-world data. Yes. We are not currently, it's very poor, the use of real-world data and real-time data. For a health professional, it's quite important to see the data when they need to see the data, not after weeks or even months. And this is the problem we have. I said before that Greece was delayed in establishing a quality agency for assuring quality. So we are now at the point that we are forming a core set of quality indicators. Greece doesn't measure at the moment any quality indicators apart from hospital-acquired infections. So if you visit OECD health database or WHO health base, you will not find information about the quality of the services. So it's the first time that we are forming a core data set of quality indicators, and there is a major barrier and challenge because we lack data from various sources, and we don't have real-world data also to share. So I think these are, to my knowledge, some of the first priorities.
Okay, but I will ask you again a second question now. How do you see the role of the academia in educating this personnel? But before answering, I would like to bring to light that there are many private institutions that have lifelong learning programs that at some point provide practical education to practitioners of any discipline. But at the same time, maybe we need also the academia into the game to provide a more academic background. So where would you balance? Let's say you have to invest in education of people that are practicing healthcare. How would you balance between having lifelong learning programs or targeted masters, bachelors, whatever, from the academia, and how would you combine that with the private initiative in having an ecosystem about the health practitioners? So how would you do that?
Yeah, I think that this is this is quite important. Academia, for me, is the sector where this training should be based because we need to understand that we need common methodologies, so scientific perspective, because if the data is wrong, the decision is wrong. So instead of getting wrong decisions, I think it's better not to take any decision. So in order to inform policymakers, you have to work in the same methodology and with the same scientific way. So academia should be closer to the health sector, healthcare organization, and I think this is something that we should also, identify as a weakness. Maybe the academia has been working a bit apart from the practical, everyday clinical practice regarding digitalization, data analysis, etc. So, public-private partnerships, yes, I think may be here
an answer
for the way forward. Because I think, yes, there is a lot of knowledge, but this knowledge has to be systematized, and this knowledge has to get to the level of the everyday clinical practice. And I think we have a long way to succeed that.
Okay. So, Stelio, again, what is your viewpoint, or where should we invest, and what are the technologies that we should target at, starting from now, for the next 1 or 2 years, perhaps?
I think that there are many topics and sectors that we need to invest, and this investment need to be done simultaneously. We cannot start with one sector and waiting for this sector to be developed, and after that to focus on another sector, and this story goes on. We need to focus in a simultaneous way. But for me, first of all, we need to invest to health sector to understand what is coming. Second is to people to understand the power of their data. And finally, we need to invest on new applications to show their power to both health environment, nurses, medical doctor, but also to people, and to understand, to show them that if we combine applications with knowledge, we can get what we said before, real-world data, which are more precise, and we know we can give better treatment to people. So the base of what we are discussing today is the knowledge, the new knowledge, and the education that people need to get, both sides, healthcare professionals, but also the patients themselves.
It's good that you stress the need to focus on the people.
Exactly.
People should be familiarized with such technologies, should understand what is the benefit. If you don't see the benefit, then why participating in that, right? So you're really right about that. So, Dimitris, what kind of ministry would you like to have now for the sake of our discussion? You are the Minister of Development and Investments in Greece, okay? And now, where would you invest? In technologies and infrastructures?
The right thing is always to invest to people. So people is the most appropriate. If you want to invest people that came from University of Christos, it's okay. People that came from our university, it's okay. From Polytechnic School, it's okay. For us, the investment is within the people. That's why we create this, we have this accepted proposal right now for the AI factory. The AI factory is based on academic synergies. So we have an important collaboration with the National Technical University of Athens, the Kapodistrias University of Athens, our university, the Aristotle University, the Demokritos, the Institute Center, and we have the strong collaboration with the Growth Fund. Mm-hmm. So we are not just academic, we are in a great collaboration with the Growth Fund, Hypertamio, if you don't understand the word in Greek. So we start this, we are one of the 7 AA factory in Europe. Some more will come after the call of February. Probably there is the case that we will send another proposal in May for create another factory in the Western Macedonia area. And this kind of infrastructure will be a place where the small companies, the SMEs, could run their own experience in collaboration with the academic experts on AI. So that's why we built this, in order to give, let's say, for an example, we can create a sandbox for a company. The company can run the experiment right in our AI factory, and this example can run in the German AI factory as well, or can run in Leonardo supercomputer in Italy. Or in Lumi in Finland. So in that way, we invest in the ability to be part of the giga AI factory within Europe. And this is quite important for us. But first of all, we invest in people, and then the money from the European Union come to follow our proposal.
Okay, nice. So let's have
Can I say something about the data?
Of course.
We in GRNet, we are not controlling your decision to store or not to store data. For us, this is not actually your work. Our work is to protect the data and to ensure that the data will be protected from any danger way of whatever they want, whatever could happen. So that's why we are trying to protect the data and clear all this data for usage. The same happens in all the European countries right now. It's not a Greek initiative. Okay.
Nice. So, Christo, let's have the final round of questions. And I would like you to give us some case studies, some specific examples that it's good to mimic, it's good to follow. So something that comes from the actual practice of the digital transformation of the healthcare sector that you consider as a nice example that maybe we should follow also in Greece, or either it comes from real life practice or it comes from your projects like EAS, like Secondo, which is about insurance, like...
I believe that, first of all, we have to have some high-level strategy. For example, in the health sector, we have to decide what type of digital transformation we want and how we're going to achieve this. This digital transformation has some, let's say, some specific sectors that we have to invest and we have to make progress. For example, is technology, the participation of the professionals. It's really a need to have them educated and ready to use the technology, to see the new technologies like cybersecurity and AI, how this can be incorporated and protect the people, the infrastructure, the people and the professionals. And a very important issue that came from this discussion is the awareness of the participant, of the citizens.
Yes.
I think it's very difficult, and we have to invest on this. Following your previous question, is because, okay, we can invest and provide the best system, but if the citizens do not agree or do not accept or afraid of them. I remember I was a year ago or 2 years ago about these digital IDs, and there were discussion in the media, oh, they're going to, what will happen? Nothing will happen. We used to have a paper copy of our digital ID, and we are going to transform or replace by electronic. Why? Because everything now is becoming electronic.
To pay blind.
We will have many benefits from this electronic transformation. So this is something, but we have to invest on this. Because we're discussing in academia, in academic or political fora, we discuss, we decide something, but we forget.
It's not communicated to the people.
It's not communicated. And it is very important. And my last comment is, since I'm working on training and education program, I see the most important issue to focus on the young people, the young generation, the pupils, the students, and this will act as an ambassadors to the family. So in this way, we can educate the Greek society. And I believe also the European society, okay.
Yes, why not start with the younger persons?
Yes.
That will be in the forefront of using these technologies. So maybe this should be the first priority, you're right.
And I see that the school program is too static, at least for me.
Yes.
We have to invest or try to find other ways how to communicate with young people.
Familiarize them with digital technologies, with the use of data, with cybersecurity, with the use of AI. Yes, you're right.
You know, we have a big problem in cybersecurity, and the only way that we found in order to familiarize the people with cybersecurity is to touch the young generation. Otherwise,
you're right.
We cannot communicate.
Okay. Dimitris, what is your opinion? Is there any exemplary case study that you want to bring to light, or at least provide us with some future targets on what should we do next in order to have the digital transformation of the healthcare ecosystem by 2030?
The central point is the data, the users of data. There is no other issue. We clear the data, we install, or we make this collaboration of this network with the project officer for the data in the public sector, and then within Europe, everybody can use this data in order to create knowledge. This is quite important in health. We have to have consistent data, clear data, of course, GDPR rules or whatever other you need, and then we can use AI in order to produce interesting results for the health sector. And we have invested a lot of money and time in order to have this health sector under development in Greece.
Nice, okay. Daphne?
Yeah, I think one of the progress that is being now made is collaboration between University of Athens, our department, and WHO, where for the first time in Greece we are setting up a human resource information system. And just to give you an idea, currently we know only the stock of the health professionals within the health sector. So we don't know how many graduates we have every year, or we do have the data, but they are in a different ministry. We are not really aware in real time how many are retired or they are leaving the system, so we don't have any idea about the trends. And this is what a human resource information system does. So we are facing geographic imbalances, staff shortages in rural or remote areas. We are facing shortages in specific specialties, medical specialties, where we only recognize these shortages only when we see it in the health sector. So this information system will help us plan, do an HR planning about what the needs of the country are in 2, 4, 10 years, so that we can produce the health professionals that we need in number, but also in skills, knowledge, etc. And I think this is quite important. As I said, it's the first time that we are developing such an information system in our country. And I think it's a good model of how we should really analyze the data and produce meaningful knowledge about the future. And this will help us also allocate rationally the health personnel that we have, because even within the shortages, the health professionals are not rationally allocated in the country between the different regions. This is a tool, a digital tool that can help us very simply really improve the quality of the services that we offer. So that's an example. I hope within the next year this will be also completed.
And I want you to add something more. What should be the role of your organization, the Organization for Quality Assurance in Health, to this direction? So how you envision that?
The vision of ODP, which is the name of the organization, is to help people get access to the healthcare services, and not only access, but access to qualitative healthcare services. So without measuring the quality of the healthcare services, without taking into account the resources, the numbers, the skills of the staff, the equipment, there is no way to set a base and actually know the directions that we should move in order to improve. So for us, the electronic health record is a tool that is very much needed, and we expect it, so that we can work with health professionals and try to minimize clinical variation, because there is, between urban and rural areas, different hospitals. This knowledge will help us share good practices and assure the standardization of care provided. Right now, we are not at the point of knowing where exactly we are. So all these efforts going on currently will help ODP to assure that the quality of the services is the one that we expect, that people are respected. It's, you know, it's a quite important dimension, this one. And an effort we are doing is also for the first time to have the patient's experiences recorded systematically. So we are we participate in a big study, OECD initiative, about, it's called PARIS, Patient Reported Indicator Survey, where Greece is one of the 20 countries participating, where we systematically will measure, and the first round is completed, the experiences of the patients and the patient-reported outcomes, so the outcomes from the patient perspective. And I think these are very, very important steps, because we need to assure that the care we provide is effective, so we have clinical effectiveness, is safe, but also it's responsive to the patient needs. So if we don't hear the needs, we will not be able to respond. I think that we are in a path we are progressing. We still need a lot of work, but I think that the progression that has been made during the last 3 or 4 years has been impressive. So I hope that this will be the case for the next years as well.
So it's good to chair for you this organization because you have a clear vision of what is to be done. It's good to have you as a president. And I also have a suggestion. Since we share the same institution, why not seeking also some interdisciplinary collaborations within the institution, so with technical departments and the School of Science. So I think this is something missing. We're going to different ways. So.
Yeah, and this is something we're trying to do. I mean, we already, as ODP now, we already start working with academia a lot, with medical schools, nursing schools, with patient associations. We are trying to build a network that was not there before.
Okay, let's see. Stelio, you know, I have a high respect for you. You are of my favorite guys. So this is why I kept you for last. I want you to conclude this session providing your viewpoint on perhaps some exemplary case studies and what should we do next as a country by 2030 and perhaps as an EU ecosystem. So take as much time as you want. It's up to you.
I don't take a lot of time. I just wanted to highlight 2 points. We don't need to be fooled. I mean, of what Professor Xenakis said from the point that every youngster, every young uses technology, but we need to show them how to use it right. This is something that we need to fight for. We need to give all our efforts to show them that to use in the right way the technology. Because using TikTok, Instagram, or whatever other application don't mean that they know to use technology in the right way. So we need from school, from other conferences, from other sides, to make the right use of their data, of their life, of their personality. This is something that we need all the sides, academia, policymakers, industry, needs to fight for, because we will reach a future that we will have educated but educated people that they will not know how to really use technology. And the other point, another point that I would like to highlight is that we don't need to cover the holes that our system has created. I mean, we are in a point of time that we need to imagine a future. We need to create the world that we want to see in a real world. We don't need to just to cover our holes in the system. As we said before, we didn't know until now how many people educated to be doctors and how many people retired. This is something from the past. So we need to sit on the same table and to discuss our future, because the future is coming, and if we are not be ready, I think that this future is going to in quotes, to destroy us, and we will stay behind. And I don't want to see the future for Greece. I think that we can find a common sense and a common points of discussion, and this is the time to do it.
Let's hope that you will be among the guys leading this, and I'm sure you will. So thank you for having this interesting discussion. Now I would propose to have a nice picture with the panelists. After that, it would be also nice to have the panelists of the next section, the next session, together with the previous ones. And I would also like to have the audience here, because it's really important to me always to organize events that are not about the panelists, but it's about the audience. So thank you for spending the time being here with us. So let's have these three kind of pictures. And I wouldn't want to forget that since we have some high-end professionals here and policymakers and professors, let's spend some time in the next 10 minutes to pass from the Elixirion Fellows their posters, give them some feedback, have some short discussion, and then let's get back inside to have the second session, which is a really interesting one about the digital transformation of the European industry. So let's have these three faces, panel one, panel 2, everyone in the room.